So you're looking at your skin, you see a red scaly patch. You've heard psoriasis, you've heard the word eczema, and you're thinking, is this one of those or is this something else? Well, there are some clues that we can use to figure out which one it is and how to tell. This is Sarika Ramachandran. I'm a board-certified dermatologist, and today we're gonna talk about eczema versus psoriasis. So eczema and psoriasis are two different diseases. Eczema tends to be itchy, psoriasis not so much. Eczema tends to occur in a younger onset in children, babies, and psoriasis tends to start in the 20s, 30s, and later on as well. But let's talk a little bit about what they look like and how to differentiate between the two of them. So if you're thinking about psoriasis, do you remember back in 4th grade or 3rd grade when you passed around those different types of rocks and there was that rock, the mica, and it had those little pieces that you could peel off? Sometimes the scales of psoriasis look similar to the micaceous scales seen in that type of a rock. In psoriasis, we tend to have thick, well-demarcated patches and plaques of lesions, sometimes little pustules, and we can also have nail changes associated with psoriasis. Psoriasis can be symmetric. When they show up, the lesions as plaques, they can be on both the knees, both the elbows, on the backside in the center. It can be along the scalp, sometimes in similar locations between both sides. So that's what psoriasis can look like. Now, if you're thinking about eczema, then you think about a finer scale. These lesions can also be sometimes pink, pink-brown. They tend to be more diffuse. Sometimes you can see hyperpigmentation or darkening in the areas that are affected by eczema. So when you're thinking about eczema, you take a look at kind of the folds just in front of the arms. Sometimes they're at the backs of the knees. Sometimes the whole body can have a little fine scaling. When we're talking about this type of eczema, we're referring here to really the atopic dermatitis. Different forms of eczema can sometimes be limited or show different manifestations in terms of linearity or like showing up in certain areas if we're talking about, say, a contact dermatitis or an allergy to a certain thing that patients are coming into contact with. You can sometimes make those diagnoses just by looking at a patient and obtaining a good history. Sometimes you can elicit a family history, both in eczema or in psoriasis. And in these cases, sometimes we do take a skin sample, which can help put us into a category. You know, when you're distinguishing between eczema and psoriasis, skin that has eczema is more prone to certain types of infections, such as staph infections. And so to that end, the care of skin that has eczema is a little bit different than patients who have psoriasis. For eczema and psoriasis, interestingly, when it's limited to a small body surface area, we often start with similar treatments, such as the topical steroid treatments. For both eczema and psoriasis, phototherapy is sometimes an option, but as we get more extensive disease, or if psoriasis has associated with psoriatic arthritis, some of those treatments start to change. If you think that you have psoriasis or eczema, see your medical professional. These videos that we have, they're a great start to think about what those differences might be, which category you may fit in, but it's also really important to see your medical professional. They can hone in on subtle differences that might really help make the diagnosis and get you on the right treatment path. Thanks so much for watching this video. If you like this video, hit subscribe for more information about psoriasis from Healthline.